Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi everyone, we're back for another episode here today. What are we talking about, Smile Sister?
I guess we're going to talk about sedation.
Okay.
It's a very, very fun topic. People actually seek it out because so many people are just terrified of even walking into a dental office. So a lot of times it comes to a point where you can't avoid it anymore. So you have to get something done. So sedation is a great tool to overcome obstacles, be it fear, pain, anxiety, discomfort, and to actually get the work done that you need.
Sure. I mean, you started offering sedation at our practice, and
Yes.
it's really changed the game in being able to treat patients who may not have come into the practice at all previously.
Absolutely. And I was doing surgeries, just under local anesthesia for years and years, like 20 years.
Yes.
And it's fine and it works, but it's a tough experience for the patient and for me, honestly. It's really hard for the dentist who's working on someone and, they're just uncomfortable. You can numb and numb and numb, but just being there with your mouth open and everything that's happening is just uncomfortable. It's not even about it that you're not numb enough. You're just like in an awkward situation for a long time.
So that's a good thing to talk about because it takes away the stigma of needing sedation.
Right.
Sure, some people might need it because they're just naturally more anxious, so they've had a bad experience in the
Right,
past.
right.
But there's also a level of you don't want to be necessarily awake for a
Yeah.
procedure that's this invasive.
You don't. And I mean, to be honest with you, most surgery can be done with just local anesthesia. But the thing is, if you are sedated, it just creates a whole other level of comfort for you and for the practitioner who's working on you.
Let's take a step back. What is local anesthesia and what is sedation?
Right. Okay, so local anesthesia is just basically numbing of the area that we're working on. That's what you get basically when you're getting a filling or any other kind of dental work. We just numb the area that we're working on. You're numb and you don't feel anything, but you are aware and awake. So you are going to feel like pulling on your cheek or tugging, or your neck is, uncomfortable, or your mouth hurts from being open too long, or there's saliva. Like all those other factors are still in play. Even though you're numb and you feel no pain, you're still feeling all the other events that are happening. And the noise of the drill, I think that's a huge one.
That's a big
for
trigger.
a lot of people. Yeah, that's a
Yes.
big trigger.
So local anesthesia, what we would give somebody who's getting a filling or anything
Right.
like that.
Right.
But you're fully awake and aware of what's going on, and you feel pressure, so pushing.
You do
correct?
feel pressure. Local anesthesia doesn't take away all your sensation. You still feel pressure. You still can hear. You still can smell, taste. Like all those other sensations are still active. So you're still there and aware and fully, awake and understanding what's happening.
So that is the basic anesthetic that we would give. So let's
Yes.
talk about there's a range of things you can do from being fully awake and just getting numb, basically,
yes,
to
yes.
being fully asleep. So what are the other options?
Yeah,
people
so
might
there
have?
is a huge range. It's like kind of like a scale where you're fully awake and you're just numb to there's a machine breathing for you. And we don't want to be on the breathing for you level in a dental office.
Sure.
We want to keep it kind of in the middle. And in the middle is a state where you're still able to breathe. You're still able to respond when someone talks to you, but you're basically out of it. Like you're kind of in a state of like half asleep. But if I talk to you, you can talk back. You can still breathe on your own. So you're not intubated. There's no tube going down your throat. You're still able to function. Your body is still working and doing everything.
So this is the type of sedation that you provide
Yes.
when you do wisdom teeth extractions specifically.
Yes. So this is moderate sedation. one layer before that, so one layer before that is, for example, just getting nitrous with a little kind of sedative pill
That you would swallow.
that you could swallow. The thing with that is we really can't titrate it. It's just one dose pill. So some people can go really deep into this spectrum, and some people are still awake because it's just one dose. We really have no control over how it's gonna affect you. So
So titration means being able to adjust the levels of the sedation.
that's right. Titration is we give a little bit, we see how you respond, and based on your response, we adjust whether we give more or not or whatever else we do. But as far as the pill, it's just boom, it's a one dose, one
and then you
and
have
done.
to sort of wait to see how it affects
the
It
person.
takes time. It's not so immediate.
Yes,
And then you can dose again. Then you got to wait again. So it's a little bit stop and start.
we don't dose again. It's a one
don't.
dose. Yeah,
At the beginning,
it's just a one dose.
when you do sedation and you give them the pill at the beginning, you just give the amount and then
that's
they
it.
go in. That's
it. One dose. That's it.
All right.
And I've seen the pill where it's taken someone to a very, very deep level just with one dose pill. And there's other people that are basically like as if nothing. And so it's just such a range of variability.
So why is that? What are the factors that affect that?
I mean, age is one of them. Older people do tend to get more deeply sedated and get affected quicker. And people who are like former, drug users or who smoke a lot tend to not get affected.
Right.
But it's honestly an unknown. Like there is no, unless you take these medications regularly and you know how it's going to affect you, it's kind of an
hard to say.
unknown. Yeah, it's a black box. So
in a way, it could be more dangerous or more unpredictable
It is.
than getting IV sedation, which
Yeah.
is what we do here.
yes. So let's just go back to make sure. So first level is just getting local numbing.
Sure.
Second level is getting the gas with some pill
So
or
you're
just
talking
the
about
gas.
nitrous oxide. So
Yeah,
so
nitrous oxide.
is laughing gas.
Laughing gas. And again, nitrous oxide has a huge range too. I mean, you've seen it. What have you noticed with nitrous?
So sure, nitrous. I mean, you could do laughing gas without any other sedatives.
Yes, you
right?
can. Yes.
And it can have a calming effect.
yes.
You're definitely conscious. You can definitely remove it and walk out of the office like normal. So those are the benefits of it. You're
Nitrous
not
is amazing
sedated.
because you breathe it in, it affects you. And then as soon as we remove it and you take a few breaths, it's out, it's done. It's just an amazing, sedative because of that, because it's quick to act and quick to get out of your system.
I find that it can be helpful for patients who are in the mindset of wanting to be relaxed and calm.
Yes.
So you can't be someone who is super, super anxious because it doesn't work. It
No.
only works if you're just slightly and you just need something a little extra to calm you down and you're in the correct mindset for it. Then it can be very, very helpful.
Yes. Nitrous also in dentistry, one of the things is because we apply it through a nose mask and we're working in the mouth, a lot of it tends to escape because you tend to breathe in and out of your mouth, or you breathe in through your nose, you breathe out. So a lot of it is kind of like lost, but
Could be.
you're not like fully getting it all the time. So it's a little bit, again, unpredictable because of that. So if you're laying there with your mouth closed and you're focusing on breathing in and out of your nose, you're going to get the effect. But then as soon as we start working on you and you open your mouth, you take a few breaths with your mouth, the effect dips.
Yes.
So
That's a common thing that they say, I feel it, and then you start working, they're like, I don't feel it anymore.
That's right.
And you gotta up the dose a little bit.
exactly, because
Sure.
it's so quick to
Dissipates.
like dissipate. Yeah.
Yes. Okay, so you
Okay.
can come in if you're a little bit anxious and just something to relax, then just doing laughing gas,
Yeah.
nitrous oxide can be helpful.
And with laughing gas, you can drive yourself here and you can drive yourself home.
Perfect.
Same thing with local anesthetic.
Yes, definitely.
Yes.
So you still need local anesthetic. All of these procedures,
Yes,
all of
yes,
the
yes.
sedation types that we have, don't numb you. They just make your level of consciousness a little bit different.
They relax you.
They relax you, yeah. So you still need to get numb.
You still need to get numb no matter which one of these we do. You still do need to get numb.
So you can just get nitrous and have anything done. We have people who do nitrous just for a deep cleaning. Even.
Yeah, or a regular cleaning.
Or regular cleaning,
yeah.
Sure. And then, so the level after that is to do nitrous plus to take a pill, right?
That's right.
So what are the options? So there's anti-anxiety pills you can take even the day before, correct?
Yes. The day before you can take one just to help you sleep, because that's another kind of triggering thing that people are anxious about their upcoming appointment. So you can take one the night before to help you sleep, and then you can take one here before the procedure, about 30 minutes to an hour before we start.
So you would come early, take that pill, and just hang out with us.
Hang out with us. We'll monitor
sit in your chair,
you. Yep.
Until you feel very relaxed, and then you can get started.
Yes.
Okay.
And with the pill, you do need a driver. You cannot drive yourself. You cannot walk. People are like, I'm just walking. Well, no, you're out of it. We don't know how out of it you are, like we just talked about. You need somebody responsible who can be there with you.
So a must for sedation, other than just getting laughing gas or local anesthetic, is you have to have someone that you trust be here to pick you up and take you home, or
That's
else we won't let you go.
No, we cannot. Yeah, you have to have somebody responsible who can be with you after. Okay. Yeah.
All right. So that's the second level, anti-anxiety, and then what's next?
I guess the next thing that we do here is just the moderate IV sedation. So again, remember, this is a range. We want to keep it in the middle. We don't want to go to a place where you're not breathing and you need a tube down your throat, you need a machine to breathe for you.
Right.
We're keeping it in a level where you're still breathing, you're still responsive. That's called moderate IV sedation. So with that, we do an IV. We give you the medication in smaller doses and we observe you. So we'll give a little bit, we'll watch you. If you're falling asleep and you're relaxed, we'll start the procedure. If not, we'll give another dose, wait a few more minutes, watch you until you get to a level where you're sleeping, you're relaxed, but you're still responsive and breathing, and then we start the procedure. So in a way, it's much safer than the pill, but, there is obviously like other things. You have to have a driver, you have to put a day aside. So there's other things you have to deal with.
So normally, how long is somebody under when they're coming in for, let's say, 4 wisdom teeth extractions?
So again, the way we do it here, we keep it short. So less than an hour is what we like to do. We've had surgeries go longer than that, but that's our typical, like about an hour. You get your 4 wisdom teeth taken out, and then you wake up and your person picks you up. So the whole thing can take about 2 hours from the time you walk into the office to the time you walk out of the office. So by the time we seat you, we put all the monitors on you, get you sedated, do the procedure, and get you out.
That's pretty quick.
It is.
2 hours.
It's not meant to be a very complicated thing. It's meant to just help you get through the procedure. And I can tell you that these wisdom teeth procedures without sedation take longer.
Okay.
They take longer because of all the factors that we talked about, because you have to stop, take a break, close, jaw, saliva. There's so many steps, and we have to stop and keep making sure that the patient is okay, they're able to continue. Whereas with sedation, they're okay, they're relaxed, so we can just get down to it and get the procedure completed.
Yeah, so it's easier for the patient, easier for the doctor as well, because
It
you
is.
can just concentrate on doing that job
Yeah,
and not worry about the patient in the sense of their consciousness and their comfort level, because they're
comfortable. Yeah. One thing that people really fear is, what if I come out of it in the middle? And if you come out of it in the middle, first of all, you're not going to come fully out. Sometimes, for example, you're sedated, you're comfortable, but as soon as we start working on you, you're just like, oh, okay, you wake up a little bit.
Yes.
We just give you a little bit more dose. That's it. That's the good thing about titration. You can add a little bit.
Yeah.
So I've never had anyone just like jump up and be fully awake
here.
in the middle of it.
And even if they did wake up, you were fully numb.
Yes,
right?
yes.
It's not like you're going to have excruciating pain. You just
No.
might become aware of your surroundings a little bit.
Yeah, but also a lot of these medications have an effect where you forget. That's a huge kind of like benefit of these medications is that not only do they relax you, but you also have a
feel
memory.
amnesia.
Yeah, you get amnesia. So whatever happens, you won't remember. When we're giving the post-op instructions or people after the surgery are like, how did it go? Did everything go well? I'm like, I'm going to tell you, but you're not going to remember. So I'll call you tomorrow.
That's why we write it down on paper,
Yeah,
tell it to the person who's picking them up,
exactly.
and call them the next day
That's
because
right.
they're going to forget everything you
Yeah,
said.
everything you forget. And that's a benefit, right? Because
Yes.
maybe you don't want to remember whatever happened during your surgery.
Fair
So,
enough.
Yeah.
Yes. Okay.
So sedation has been a good addition to our practice.
I think so.
And I think it helps to get through a lot of these barriers.
So we want to keep the sedation short, like keep them under for a short duration of time, but we can provide sedation for other procedures as well if needed.
Yes,
right?
we can. Yeah.
So let's say someone comes in and needs an implant placed and they're very anxious. So we could sedate for something like that.
Yeah, I mean, I did sedation this week for someone who just needed a deep cleaning and then someone who needed implants. So we do it for different procedures, not just for wisdom teeth.
Wisdom teeth in particular, because it's more invasive, because it's a surgery, pairs well with sedation.
It does, and it's quick.
Yeah.
Also, let's talk about who is not eligible for sedation in our office. Obviously, in a hospital setting, everyone's eligible for sedation. But in our office, we try to see people who are healthy, who are doing these quicker procedures. So if it's something long, like that's going to take like half a morning, we don't normally keep you sedated for that long. We might give you a little bit to start, but then we just let it kind of like
taper out of your
taper
body.
out. Yeah, we don't keep you under for a long time.
And it works well because most people who want wisdom teeth extractions are generally younger, generally healthier in that sense because they're younger anyways.
Yeah, and that just has to do with the facilities that we have here. For people who are a little bit maybe sicker or older, we do bring in another anesthesiologist. And the purpose is because he is able to do the, intubation, is able to breathe for you. So if something happens, there's that extra layer. And for some people, we just absolutely, we won't do it here in the office. Like some people just need to be in the hospital because there's just so many underlying medical conditions and the risk is too high in a dental office sometimes. Sure. So it's, case selection is a big part of it. But generally speaking, for everybody, normal, healthy people, sedation is an option.
Yeah. So what kinds of underlying illnesses would disqualify them from getting sedation in the dental practice?
We talk about ASA levels. So ASA 1 is the person that we want to see here. And ASA 1 is someone who has no underlying medical conditions, no allergies, is not taking any medications, is like just a healthy person. Okay. ASA 2, we do see some ASA 2. ASA 2 is someone who's taking, let's say, I don't know, who has like diabetes, but it's controlled.
Yes.
Or has multiple allergies, but they know what it is and everything is controlled, or they're taking some anti-anxiety medication. Those people we see. Anything beyond that is someone that we would either bring in another anesthesiologist or refer out. So multiple medications, heart problems, history, uncontrolled diabetes, uncontrolled hypertension, sure. History of multiple allergies to different medications. So anything beyond just taking a little bit of medication but still being controlled and healthy, we would bring in extra help. But again, most people fall into those two categories.
Yes,
so,
the majority of people.
Yeah.
But it's interesting that when we take blood pressure, we can sometimes see there are people who have high blood pressure that don't get it checked and are not aware of it, right?
Yeah.
So we've turned people away.
We've actually turned people away, and then they find out they have high blood pressure and they have to get medication for it. So
for sure.
it's just people don't go to the doctor as much as maybe they go
They
to the
should.
dentist. I
Yeah,
don't
fair
know.
enough.
I don't know what's
Okay.
going on. Anyway, I hope that was good about sedation.
It
A
was
lot
very
going
helpful, I
on.
think.
Yeah.
So, if you need sedation, if you want to get your wisdom teeth out and you think that sedation might be an option, then just give us a call and we can talk
Yeah.
you through whether or not you're eligible.
Yeah, we would do a consult and make a decision. Either way, you can get it done with sedation. It's just about the setting and who and when.
Fair
So, yeah, you can find us at ladentalclinic.com.
All right.
Okay.
See you next time.
Okay, bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.